On the complex rehab wards, we use a patient-led, value-based goal-setting process. We know that when a patient's life goals and the rehabilitation goals align, it improves the patient's motivation for rehab and leads to better outcomes. Setting goals also helps us to show how the patient's improving over time and to know when they're ready for discharge. The multidisciplinary team explores values and attitudes, life roles and interests with the patient. We then collaborate with the patient and the people that are important to them, if that's appropriate, to generate meaningful goals. We then break these long-term goals down into specific shorter-term goals that work towards that long-term goal. We meet with the patient as a team every few weeks to look at how they're progressing, which goals have been achieved, and set new goals as appropriate. What we focus on with the patient within speech and language therapy sessions feeds into these multidisciplinary goals, working with the patient one-to-one or alongside the other members of the multidisciplinary team.
So what happened to me and why I needed care at Leeds teaching hospitals was about 3 months ago. I was involved in a very serious cycling accident that resulted in me having a major traumatic brain injury, as well as receiving various kind of serious physical injuries. And so the initial care that I received was really focused on responding to kind of the emergency and intensive care, helping me start to make some of those basic recoveries. And then when I'd reached an appropriate stage, I was transferred to Leeds Chapel Allerton Hospital, who really supported me in my recovery and rehabilitation journey. I had such brilliant care and support from so many staff throughout my recovery. Initially, it was very much kind of the doctors and nurses who really recovered me by identifying kind of exactly what the injuries were and what would be an appropriate treatment. Then as I continued to progress, I started, particularly at Chapel Allerton, receiving really important care and support from various specialists. Psychologists really helped me to understand the specific nature of a brain injury and to understand some strategies that I could use to be able to respond to those. With occupational therapists, really helped boost my confidence with thinking about how I juggle and manage everyday tasks, and that really boosted my confidence. I also saw some physiotherapists who've been so helpful in the care that they provided, and so they really helped me to understand the nature of the physical injuries, but crucially to learn strategies that I could use to gradually build up physical strength down all the parts of my body that had been affected by the injury. And then finally with speech and language therapy, have really helped so much. Initially through really helping me to feel more confident kind of processing information, responding to information, but then as my care and rehabilitation developed, they helped transfer to some really thinking about some specific scenarios that would be relevant to me in my job as a teacher and school leader, so they really helped with that. I think the goals that I set with speech and language really helped facilitate my recovery so much. In particular, once we moved to the goals that kind of set onto my kind of role as a teacher and school leader, it really helped make them really specific. And so we did things such as practicing explaining political concepts to a group of young people. We did things such as practicing marking A-level essays, all the way through to actually planning and delivering a presentation on my experience that I could deliver to a group of young people. And so it was really helpful and really helped sort of simulate some of those experiences that I would do in my job, but also really boosted my confidence that I could do them effectively still. The activities I did with speech and language therapy had a really clear impact on my recovery, and I think I would almost break this down into 2 stages. So there was an initial stage where the activities that I did with speech and language therapy were really boosting my fluency and really helping me to process information and to get used to being able to kind of articulate information, selecting the right vocabulary for a situation. And then as we started to shift into more kind of work-related scenarios, the real impact that that had was firstly, getting my brain back into kind of how I would operate if I was at work, but crucially boosting my confidence and realising that those long-term memories, those long-term skills that I'd learned remained unaffected by the accident. I would still be able to activate those, and so that was really helpful for boosting my confidence of thinking about an eventual return to work when I'm able to. When I moved from Leeds General Infirmary to Chapel Allerton Hospital, it marked a real step change in terms of how much of my recovery was really focused on rehabilitation. And what became clear really quickly was that rehabilitation was a real team effort. And all of the relevant specialists all working together towards ultimately the goals that I wanted for my recovery. And to be able to return to my roles as husband, father, and teacher and school leader. And so everyone at Leeds Chapel Allerton really helped me with that recovery.